Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 84-year-old dad has been in ICU for 3 months. He's ventilated with a tracheostomy. The doctors want to let him die and turn off the ventilator. We want to take him home instead. What are our options? Part 2. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another frequently asked question from our readers, and the question this week is: how long will an intensive care unit keep a critically ill patient on life support? This is another one of those questions where your mindset is crucial. It's really not at all about the answer to this question that matters. Your mindset to this question is what matters, and it's really more about your beliefs, your confidence, and also about how you view yourself in relation to the intensive care team. If you and your family, quote unquote, buy into the perceived power and into the perceived authority of the intensive care team, and if you are feeling intimidated by the intensive care team, you may as well stop watching this right now. What do I mean by that? I get a lot of phone calls and emails from extremely distressed families who have a loved one critically ill in intensive care, and many of those phone calls and emails address the same issues over and over again. When families of critically ill patients in intensive care are telling me that the intensive care team wants to withdraw life support, limit treatment, wants to pull the plug or switch off the ventilator, they usually also tell me that the intensive care team is very negative and paints all but a doom and gloom picture. This often all happens in the first few days after the loved one has been admitted to intensive care. Therefore, if this happens, if the intensive care team is telling you that they want to withdraw life support, limit treatment, want to pull the plug or switch off the ventilator, you and your family would be in a state of shock and horror. The worst thing that I've witnessed with a client a couple of weeks ago was that the intensive care team told the family that they would withdraw treatment on my client's 49-year-old family member tomorrow at 1 p.m. If you want to come, that's great, but if you don't want to be there when we do it, it'll be fine too, because we do it anyway. Bang! This is actually a real-world situation, and I was dealing with an extremely distressed family, but also with an extremely ruthless intensive care team. Thankfully, we were able to put a stop to the intensive care team removing life support, because once the family engaged me as their counselor and consultant, we were able to start asking the right questions, and we were able to correctly position their critically ill family members' diagnosis, their prognosis, as well as their care and their treatment. My client's family member is still alive and is still receiving treatment in intensive care, by the way. The bottom line is this: the question is not so much how long will an intensive care unit keep a critically ill patient on life support. This is the wrong question to ask. The question you need to ask is this: what do I need to do so that I can make informed decisions, have peace of mind, control, power and influence if this situation occurs, that the intensive care team positions my critically ill loved one in a light so that their negative, paint a doom and gloom picture and want to withdraw life support. And I'm so glad that you finally asked this question, because as I said before, if you and your family are finding yourself in the situation that the intensive care team positions your critically ill loved one's case in a light where they tell you that it might be, quote unquote, in the best interest for your critically ill loved one to withdraw treatment, withdraw life support, limit life support, pull the plug, switch off the ventilator, or issue a DNR, do not resuscitate, or NFR, not for resuscitation order, you need to start acting and, most importantly, thinking differently. A mentor of mine once told me, some games in life you don't play in order to win. Therefore, you and your family, number one, need to stop communicating with the intensive care team on a level where they are trying to, quote unquote, sell you and your family on a withdrawal of treatment, or in essence, pulling the plug, might be, quote unquote, in the best interest for your critically ill loved one. Number two, you need to get informed quickly so that you can make informed decisions, get peace of mind, control, power and influence, and have care and treatment on your terms and not driven by the intensive care team's hidden agenda. Number three, stop looking at the 99% of the families of critically ill patients in intensive care who don't make informed decisions, have no peace of mind, no control, no power and no influence. Number four, look at proven alternative ways to get what you want. Buy time to give your critically ill loved one the best shot at life there is, even though the situation might look grim or has been painted as grim by the intensive care team. Number five, get a new mindset and see yourself as a powerful force to advocate for your critically ill loved one and get the outcomes that you want. Number six, get help from an expert like me who has seen, managed and mastered those perceived end-of-life situations over and over again, and who knows how you need to position you, your family, as well as your critically ill loved one's diagnosis, their prognosis, as well as their care and their treatment. Number seven, find out what you are really dealing with. For example, are you dealing with a real or a perceived end-of-life situation? I have wrote an article and made a video about the difference between real and perceived end-of-life situations when your loved one is critically ill in intensive care. The question is really not at all about how long will an intensive care unit keep a critically ill patient on life support. The question is really about you stepping up to the plate and doing what you know you need to be doing, so that you know and understand what you need to do to get to what do I need to do in order to give my critically ill loved one the best shot in their current situations, so that me and my family are not at the mercy of the intensive care team. And the good news is there are plenty of things that you can do. Start from educating yourself for free on the intensivecarehotline.com website by reading my hundreds of articles or watching some of my hundreds of videos, or by getting more advanced and look at resources and ebooks like the 5 things you need to know if the medical team in intensive care wants to limit treatment, wants to withdraw treatment, withdraw life support, or wants to issue a DNR, do not resuscitate, or NFR, not for resuscitation order. Or you can look at the ebook, The 10 Things You Didn't Know Are Happening Behind the Scenes in Intensive Care That Hold You Back from Having Peace of Mind, Control, Power and Influence. whilst your loved one is critically ill in intensive care. Both ebooks, by the way, come with videos and audio recordings as well. Or, of course, you can simply engage me on a one-on-one counselling and consulting level, so that I can help you make informed decisions, get peace of mind, control, power and influence quickly. But the first step is really you needing to change your mindset in all of this, since in intensive care, and start looking at what only a few of the families in intensive care are doing, who get results and who make informed decisions, get peace of mind, control, power and influence. Also, stop asking the wrong questions. Frame the questions more positively, and again, don't ask how long will an intensive care unit keep a critically ill patient on life support, because this is the wrong question, and that question alone is putting the intensive care team in charge of the situation and not you. By you and your family asking more intelligent questions such as, what are the steps I need to take in order to get the upper hand in all of this, and how can I maximize chances that I can get what I want and deserve, so that my critically ill loved one will get the best shot at their current circumstances. That question in and of itself is changing the dynamics of the situation, because you are no longer focused on what the intensive care team is or isn't doing. You are now focused on your power state, and the question alone will get your thinking in motion in what you need doing to make informed decisions, get peace of mind, control, power and influence. Finally, I want to close with a quote from the Book of Survival by Anthony Greenbank. In the quote, Anthony Greenbank says, "To live through an impossible situation, you don't need the reflexes of a Grand Prix driver, the muscles of a Hercules, or the mind of an Einstein. You simply need to know what to do." You and your family know that you are in an impossible situation, that you know you need help for. Make use of the resources at hand. Start asking the right questions and start moving in the right direction now. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. how to stop being intimidated by the intensive care team, and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecare.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the phone counseling tab on the top of the website. This is Patrick Hutzel from intensivecare.com, and I see you again next week in another update.